Hello, welcome to my frequently asked questions. Today I'm answering a very commonly asked question about upper blepharoplasty. When can I exercise after having upper blepharoplasty? And in answering this question, we'll talk about the immediate recovery and what you can do and when after blepharoplasty. What are the implications if you do too much too early, and why is it important to avoid exercise early after having blepharoplasty? And finally, we'll also talk about other circumstances such as more extreme sports, other things such as diving, and when you can do these kind of activities after having surgery. My name is Dr. Julian De Silva, and I'm a London-based oculofacial, cosmetic and plastic surgeon, and eye surgery and blepharoplasty is the commonest surgery that I do for patients every single day. And the question that I'm answering today is information that I discuss with my patients on a daily basis. So in terms of exercise, what can you do soon after having upper blepharoplasty? Well, the first week is very much an investment of time, and really you want to take things relatively easy, and I'd encourage you to mostly stay at home and just take things relatively quiet and easy, because that will ensure that your blood pressure and your vital signs are relatively stable and low, and you'll heal faster. The second and third week, well, you can certainly do more walking, and that is absolutely fine. I would still avoid going to the gym and aerobic exercise, yoga, until 3 weeks after having upper blepharoplasty. Why is this important? Well, the reason this is important because the more you do in the first several weeks after having surgery will have implications for your healing. And certainly the first week, if you engage in more activity, you'll tend to have more swelling, more chance of bruising, and ultimately your recovery will be longer. The other element in terms of healing is scarring, and if you do a lot of activities and have more swelling, well, you'll tend to widen the scars from eyelid surgery. So the first 3 weeks is really an investment of time, and particularly the first week, it's an investment because you'll have faster healing, less swelling, less bruising, and heal faster. Now, in terms of extreme sports, well, extreme sports such as diving and sports that are going to put more pressure on the soft tissues around the eyelids in terms of healing, well, ideally you want to avoid these activities for 6 weeks after the surgery. And at this point, well, it is completely safe to engage in these more rigorous activities, and they're not going to affect healing. So in summary, we've talked about exercise and what you can do after having upper blepharoplasty, and really the first week is the most important in terms of investment of time, and the second and third weeks, well, you can certainly do walking, but I would avoid major exertion in that point. And overall, 3 weeks is what is required to ensure that you have a fast healing and fast recovery. I hope this information has been useful for you. Thank you for watching.